In former Fox journalist John Stossel's case, feelings of rage were at the heart of his chronic back pain. Stossel is one of a string of celebrities, including Larry David, Jimmy Kimmel, and Howard Stern, outspoken about their back pain relief via a mind-body approach. In 1999, Stossel reported on his experience in a 2020 report. Here we see him being counseled by Dr. John Sarno.
So I'm in such a rage about something that I'm making myself suffer.
But don't you see, your brain actually thinks it's doing you a favor by doing this.
By distracting me from what I really don't want to think about.
Exactly.
Stossel had suffered back pain for 15 years before learning of the work that Dr. Sarno was doing. He said that after seeing Sarno and reading one of his books, his back pain got immediately better. For a while. 6 months later, the pain came back. Realizing that he hadn't followed Sarno's suggestions, which included going to one of his seminars, Stossel finally went, and the pain got better again. Back around 2011, he said that he'd been virtually pain-free for 10 years. The idea that repressed emotion like rage can cause back pain reminded me of how psychological trauma can play out as very real physical symptoms, as seen especially in PTSD, where it can manifest as things like stomach upsets, skin rashes, and chest pain. And just as mind-body medicine for pain appears to work at the juncture of memory, emotion, and the central nervous system, one of the most effective treatments for PTSD, eye movement desensitization and reprocessing therapy, or EMDR, also deals with memory, emotion, and can lower the stress response of the central nervous system. With EMDR, the patient's focus is brought to their trauma memory at the same time they're given bilateral stimulation. This is often in the form of back and forth eye movements directed by the therapist. Exactly how EMDR is able to bring about such a change is still something of a mystery, so I was interested to hear Dr. Schubiner's take on how it might work.
Childhood trauma causes the brain to be set in a more sensitized fashion, a more high alert fashion as people go through life. If someone has been severely hurt or criticized or betrayed or abandoned in their childhood, and then later in life they get criticized or abandoned, then their brain is much more likely to turn on some kind of danger signal. I was greeting a military veteran a while ago, and he thought that his PTSD came from being in the military because of the things that he saw there and did there, which was true. But it was also because of the childhood issues that he had in his life growing up, which sensitized his brain and made him more likely to develop PTSD later in life. And so the treatment models that EMDR is, and the treatment model Mark Lumley and I have developed called Emotional Awareness and Expression Therapy, and the expressive writing that you talked about earlier, and there's a whole bunch of other psychological treatments for PTSD, all of them work to rewire the brain, reprogram the brain to not only view but also experience the events of their past in a less traumatic way, in a way which is more kind to themselves, loving to themselves, in a way that helps to empower themselves to be less affected by the events that happen, that you can't change the events. But what's interesting about PTSD is that it's based on memory, because how do we know what happened in our past? It's our memory. Memory changes all the time, and so our emotional awareness and expression therapy is based on memory reconsolidation and these other treatments you talked about as well. So the point is that the brain is neuroplastic. It's always changing, and it can change in a positive direction as we do these kinds of therapies. And the pain is a message that there's something wrong. And so the message then needs action. And that's what we're about. And if you don't need medical action, if it's not a structural problem in the body, then that's our message, that the pain and other symptoms certainly may be reversible, as opposed to just having to cope with them on and on. And if you look at the field of pain management, modern medicine pain management, most of it is based on chronic pain needs to be coped with and lived with and not cured. And we believe that we have better methods, and we've shown that through our randomized controlled research studies.
With the example of the veteran suffering trauma that went back to his childhood, I'm interested to know specifically how a mind-body approach was used in that kind of situation to reduce his PTSD.
Yeah. So one of our colleagues at UCLA, Los Angeles, works at the V Hospital there. His name is Brandon Yarns. He's a psychiatrist, and he's done several randomized controlled trials using emotional awareness and expression therapy with veterans. The veterans he treats are older. Their average age is in the early 70s. They've had pain for an average of 20 to 25 years, high levels of PTSD, anxiety, and depression. And in these randomized controlled trials using the emotional awareness and expression therapy, compared to the standard psychological treatment of cognitive behavioral therapy, he's finding much better outcomes with EAET. So an example of that would be this veteran that one of the veterans that I treated came out of the military with anxiety, depression, PTSD, pain all over his body. Could not find help through medication therapy or injection therapies through the hospital system because it's the standard treatment. It's not looking at the relationship between the brain and the body. And one of the things we did with EAET was to take him in his mind to go back to situations that were in his childhood and also situations that were from the military, so that he could go back and actually change some of those memories. In other words, imagine himself going back in time to help his younger self when he was 8 years old and his parents were getting divorced, and help him to give love, and it sounds weird, but to give love and caring to his younger self, to help his younger self stand up and speak and yell at his parents and scream at him, say, "What are you doing? Why are you doing that?" And do a similar type of thing in the military. In the military, he had people who were really coming down hard on him. And to be able to express feelings about that. And that process freed up this danger signal in his brain and made his pain immediately, after that, his pain immediately went down. And then he continued to calm and soothe his brain, telling himself he was okay, he wasn't damaging his body, do more of these emotional exercises, write about them. You know, he was housebound, literally. Now he's back at work, or he's going to school, he's studying, he's got his life back. And it's just an incredible process to see.
Very encouraging example to hear, Dr. Schubiner. Thank you for illuminating that in a very specific way. Another thing I wanted to ask you about is mindfulness. I know that this fits into the system of things that are used to help alleviate chronic pain.
Sure.
My understanding of mindfulness is it can involve focusing on something like a sound or a bodily sensation to train the mind's concentration. How does this practice fit into a mind-body method for alleviating pain?
Yes, right. We use mindfulness meditation, mindfulness type techniques in our treatment approaches. One of our treatment approaches is called pain reprocessing therapy, and it uses a form of mindfulness. But it's a specific form of mindfulness which sends feedback to the brain to tell the brain that the symptoms are not dangerous, to appraise and look at the sensations, even if it's pain, which is horrible to be in pain, or nausea or fatigue or anxiety, to look at those sensations with less fear, to observe them, to step back from them. And that's part of mindfulness techniques. What's important about our work is we're combining these mindfulness techniques with the assessment techniques that I talked about earlier, how we can know for sure that certain situations, certain conditions in the body are not structural. So if you're applying mindfulness to a condition you think is actually structural, it would only have a limited benefit. But if you're applying mindfulness to a technique, to a situation where you are assured that it's not damaged in the body, like Larry David was, right? You're stepping back, you're observing the sensations, you're calming and soothing that danger signal in the brain. That can have very powerful effects on reducing or actually eliminating pain in these other chronic conditions by this combination of knowing that it's not structural and applying this calming, soothing message to one's own brain.
That makes sense, having that foundation of knowing that the pain doesn't have a structural cause. I can see that lightening a person up to be able to expand their awareness and experience that pain with less fear. Knowing that this mindfulness involves focusing on bodily sensation, can you give a more specific example with Dr. Schubiner of exactly how this might play out in the therapy?
Sure. Well, you can focus on the sensation. If you're feeling anxious, you can focus on the sensation of anxiety in your chest, feeling it, noticing it, watching it, observing it, seeing what happens when you tell yourself, I'm okay, I'm safe, I'm not in danger. Maybe it goes down and then you start to worry about something and then it goes up and you can see it going up and down. With painful sensations, sometimes what will happen is the pain sensation will shift a little bit. It'll be over here and it'll be in the middle part of the back and then it'll move to the lower part of the back. And then you're going like, whoa, what's happening, right? Because a structural damage situation doesn't shift around, doesn't move like that. Where you see that it'll be triggered by the wind or triggered by certain thoughts or triggered by heat or cold or the weather. And all of a sudden you begin to realize, wow, actually it does change, it does shift. It actually is my brain moving it around, making it go up and down. And when you see that as part of mindful awareness, that gives you more understanding of what it is, less fear of the sensations. And the less you fear them, the more you can observe them, the more you can maybe even smile at them sometimes and say, oh, I see, it's okay. Realizing that your brain isn't trying to harm you, isn't trying to betray you. It's actually trying to protect you or alarm you or alert you, kind of like a smoke alarm does if there's some kind of injury in the body, or in the case of neuroplastic pain, if there's some kind of stressful situations in life that your brain is reacting to.
I think this really bespeaks a kind of revolution in the way that we relate to ourselves and our brains, because I think we're often in a kind of conflictual relationship with our brains. And these kinds of approaches, mind-body, like the eye movement desensitization and reprocessing that I was talking about before, are really intriguing because they seem to kind of bridge that communication gap and open up a channel of mediation, perhaps, between the physical sensation and what someone's emotional state might be.
Yeah, right. I think we all know that we have relationships with other people. But what's I've been fascinated to learn is that we all have a relationship with ourselves, how we treat ourselves, how we think of ourselves, how we see ourselves. And when people see themselves as being, inherently bad or inherently a loser or inherently not smart or not good enough or not pretty enough or whatever, then those kind of messages that we're giving to ourselves can be detrimental and can cause the brain to feel afraid and fearful and can cause symptoms like anxiety, depression, fatigue, and pain. And so when we change that relationship with ourselves to begin to see ourselves as actually being okay, being smart enough, being good looking enough, being caring enough, being enough, that can make a huge difference in how our brain treats us, because how we treat it feeds back on how it treats us. And that is part of this revolutionary understanding of how these mind-body conditions work and how they can be reversed or dramatically reduced.